Hello, and welcome to a more in-depth exploration of what is public health. And in this lecture, we'll explore the components of the public health system and contrast public health with clinical care. So, just a reminder that public health activities or community health activities are activities aimed at protecting or improving the health of a particular group of people, whether it's people who live in the same neighborhood or same city, or people who share a particular identity. Whereas personal health activities are things that we do on an individual level. And clinical care, which we do as birth workers or other healthcare professionals, is focused mainly on the individual, which is not to say that we don't contribute to the health of the community or the health of our population. So let's take a look at the components of the public health system. This triangle here is taken from the Centers for Disease Control in the United States, but most nations, most developed nations, have something very similar with federal agencies, government agencies, clinical care delivery systems, community-based organizations, state, tribal, local, and territorial health departments, and a variety of different organizations that fit into this. So we can think of the public health system as the network of organizations that contribute in some way to improving the health of a particular community or the population at large. So we're going to go through these in a little bit more detail. So starting at the top of the pyramid, we have governmental health agencies, and these are part of the governmental structure at the federal, state, provincial, or local level. These are funded primarily by tax dollars and managed by government officials. They have authority over some geographical area, again, federal, state, provincial, local, county, city, depending. And they exist at four levels: international, national, state, and local. So let's talk about the major international health agency, which is the World Health Organization. It's the most widely recognized international governmental health organization in that the government of many different countries across the globe contribute funding to the World Health Organization to deal with global health issues. The World Health Organization is headquartered in Geneva, Switzerland, but it has 6 regional offices around the world, and it was founded in 1948. And its mission really is to address global health challenges, ranging from trying to create systems of healthcare, comprehensive national healthcare systems in all countries, responding to global illnesses like COVID-19 or monkeypox, developing economic systems so that people can be healthy. So that's just an overview of the World Health Organization. You can find out more about them at their website. Uh, National health agencies exist at the federal level, and each nation has a department or agency within its government responsible for the protection of health and welfare of its citizens. So to continue, in the United States, the primary national healthcare agency on the federal level is the Department of Health and Human Services. However, because health has to do with the environment in which we live and work, Other departments, such as the Department of Agriculture, the Environmental Protection Agency, OSHA, Occupational Safety, has to support the Department of Health and Human Services in its mission to protect and promote public health. So in the U.S., the Department of Health and Human Services is headed by a secretary who is appointed by the president and is a member of cabinet. There are 11 operating agencies and 10 regional offices. There are a variety of different agencies within the Department of Health and Human Services. For example, the CDC, Centers for Disease Control and Prevention, is under the umbrella of the DHHS. So is the Agency for Healthcare Research and Quality, the Agency for Toxic Substances and Disease Registry, Food and Drug Administration, Indian Health Services, National Institutes of Health, Substance Abuse and Mental Health Services Administration are just a few of the agencies operating under the Department of Health and Human Services. And in Canada, you also have Public Health Canada, which has a variety of agencies working under its umbrella as well. Many states and provinces have their own health agencies whose purpose is to promote, protect, and maintain the health and welfare of their citizens. So their focus is on that regional level, on that state or province. So typically they take the initiatives and focus of the federal agencies and promote those within their own states based on what their own states or provinces need. Stepping down a level, we have local health departments, which may be placed in a city or a county or a region. And they tend to do things like inspect restaurants and public buildings for cleanliness and safety, detect and report certain diseases at the local level, which are then amalgamated at higher levels up to the federal level, and assist with the collection of vital statistics. They may also develop programs for improving health with local communities. We also have some quasi-governmental health organizations. So these are a little bit of a mixture between governmental health organizations and what we're going to talk about in a minute, which are voluntary health organizations or private health organizations. They don't work under government supervision like a government health department, but they do derive a lot of their funding from the government and work from the government. So, for example, in the United States, if we think about something like the American Red Cross, it's not run by the government, but it does receive a lot of its funding and work directives from the government. However, it employs individuals as a private employer. And it also raises funds in addition to its government funding. Now, non-governmental health agencies, non-governmental organizations, NGOs, are funded by private donations or membership dues, and they have arisen to meet the health needs that fall in between the gaps of the federal, provincial, state, local health departments. They are free from governmental interference, or at least in theory, and they have to meet specific guidelines related to their not-for-profit tax status. And there are many different types of non-governmental health agencies that we will talk about in a little bit more detail. So the first category is voluntary health agencies, and these typically are created by one or more concerned citizens who really wanted to advocate for a particular health issue that was near and dear to their heart. And these can be at the national, state, or provincial or local levels. Typically, if we think about national organizations, they may be focused on getting research funding for more research into particular disease, for example. And then they may have local offices that carry out local programming. They usually have a combination of paid staff, but they also rely on the work of volunteers. They often raise money for programs of research, they provide education, they provide services, and they conduct advocacy. So because they're not primarily funded by the government, they may have some government grants or contracts, but because their primary funding comes from other sources, they do a lot of fundraising. So one example in the United States would be the March of Dimes, where they are focused on preventing preterm birth. And they do a lot of fundraising in order to fund research and programs related to that issue. Professional health organizations are made up of health professionals who have completed specialized training and have met standards of registration, certification, or licensure for their fields. And their goal is to promote high standards of professional practice. These are typically funded by membership dues. So we can think in terms of our various midwifery organizations or doula organizations, our local, state, provincial, national, um, regional, like North American midwifery organizations would be examples of these, along with some examples you can see here: the Canadian Public Health Association, the American Public Health Association, the American Medical Association, Sonography Canada. So these are all organizations made up of some of people who share a particular profession or practice, who work together to make sure that the practice is of high quality. We also have philanthropic foundations. So these are institutions that are endowed with money that spend money on improving the health and wellness and situation of all humans. Some will do a variety of different issues. They may fund health and education and the arts, for example. Some will focus only on the on health. They can fund programs and research on prevention, control, treatment. So some examples might be the Bill and Melinda Gates Foundation, Robert Wood Johnson Foundation. There are many foundations that serve particular local communities. These are usually smaller. They have smaller budgets. They may, for example, have, 5,000 or 10,000 to donate to a local cause, as opposed to something like the Bill and Melinda Gates Foundation, which might have millions to spend on something. We also have service, social, and religious organizations. So many of these don't have health as their primary mission, but they make significant health-related contributions. So there are many organizations that are set up as service organizations, and their members can do service in the area of health. Same thing with social organizations like the Elks or the Shriners or the Lions. And we can also think about religious organizations. Many religious communities, churches, temples, mosques, other houses of worship do make a significant contribution to community health, whether it is through volunteering, providing space for services, providing direct services, etc., and creating community. And of course, private businesses also have an involvement in community health. In the United States, their biggest role is the provision of healthcare benefits, but many also offer worksite health promotion programs to try to lower their healthcare costs, reduce absenteeism, and generally ensure that their employees are healthy. A lot of corporations will also set aside their own funds for donating to different charities. So corporations may set up their own foundation to donate either money or equipment. So, for example, a software company or a computer company might have a branch that is a not-for-profit foundation where they might donate computers and software um, to nonprofit organizations, for example. So there is sometimes some crossover into these different categories. So hopefully this has given you an overview of all the different components of the public health system. The healthcare system, the healthcare delivery system, is part of the public health system, but it's much bigger. And each of us as professionals, each of us as individuals, as citizens, plays a role in that public health system as well.